open your mouth for me, and I'm just going to pop that in there, okay? And just close your mouth and don't talk. Yeah, just so it's underneath your tongue, and don't speak at all, okay? Good. Let's have a look. Now that's perfect, but we do like to do 3, just to get kind of an average. So just open wide for me. Good. And yeah, sometimes it does take, it's normally the first one that takes a little bit longer, but sometimes it can take a little bit of time to find itself. Good. And we've done 1, 2. Let's do 3. Open wide and just pop that in there. Okay. Good. Yeah, no, that's very good. You're doing great. Perfect. So your temperature's perfect, which is a good sign. Because a lot of the time, if you have any type of infection within your body, one of the first signs can be a slightly raised temperature as your body tries to fight it off. Now, if you can open your mouth up for me again, I'm going to use this. This is just a tongue presser. Yeah, it just holds your tongue out of the way just so that I can see your tonsils and your glands and things back there. So if you can open wide for me again, while I just pop that in there. And I'm just going to have a little look. Can you just give me a little perfect. Perfect. I'll just have a little look around there. And we'll have a little look around your mouth as well. Do you happen to have any sores or anything that you've... A little bit hard to answer me, isn't it, when I've got this in your mouth? Okay. Good. Yeah, I think everything's looking great in there. There's no problems there. So what I'll do now is I'm just going to have a little feel of your glands on your neck, okay? Just make sure there's no lumps or bumps there, okay? Have you had a sore throat at all? No? Good, okay. Feel it goes there. And just a little bit down this side as well. Okay, just rub on this side. And down this side as well. Just want to make sure we've got everywhere covered. I'll move a little bit down now. I'm just going to feel across this area as well, okay? And do let me know if when I'm touching you anywhere across here you get any pain or any strange sensations, okay? Okay. And again, none of this hurts, correct? Good. Okay. And have you had a cold, a cough, anything like that recently? I mean, half the UK have had some sort of cold or cough recently. But other than, yeah, have you had anything that's lingering, any coughs that's been lingering, anything like that? No? Okay. What I'm going to now is I'm going to have a little listen of your chest, okay? So we'll start with your lungs, and then I'll just have a little listen to your heart. Yeah? Okay. Let me just pop these in. I have a problem with these because of how many piercings I have in my ears. So it's a little bit hard to get them in. Right, I'll pop this on your chest. And if you can just take a deep breath in for me. Good. And exhale. And if you can just take another deep breath in for me. Good. And exhale. Good. Move it over this side. And if you can take another deep breath in for me, please. Yeah. It's hard to hear your chest over my tummy growling, I know. If you can take another deep breath in for me. Good. And another one. Okay. And then I'm just going to swing this round the back there. And if you can take another deep breath in for me. Good. And if you can do the same again for me. Good. That's great. And then we're going to go back on this side, but we're going to go around the back. And if you can take a deep breath in for me again. Good. And just a last deep breath in for people, they have what we call white coat syndrome. So they just have an elevated heart rate whenever they're around any type of medical professional. Yeah, visits to doctors, nurses, hospitals, any kind of clinical setting. Yeah, the heart rate jumps up quite a bit, and it stays like that until they leave. Okay. Okay. Yeah, no, that sounds great. Do you have any concerns yourself in terms of anything specific? Yeah, have you been getting sort of any chest pains during activity, anything like that? Have you been noticing any palpitations, anything? Yeah, do you get faint? Have you been having any fainting symptoms? Anything that's just not considered normal, I would say? No? But that's great. That is awesome. I do know that on the record when you called, there is a little note on your record that says you've been a little bit worried about a few skin lesions that you have, yeah? So what we can do while you're here and we're doing this checkup anyway, we can have a little look at those if you like, yeah? So just one up there, and where is this? Okay, great. Well, I'll come a little bit closer, then I'll just have a little look at this one first of all, okay? I'll just touch your face a little bit, but yeah, if anything should hurt again that I'm doing, just give me a shout. Okay. Okay. Now just scrape across like that. Just on it, and then just push on it. Okay, and how long have you had this for? Okay. And have they grown in size at all or changed at all? And do they bleed? Okay. Okay, okay. Okay. And then the next one is just, yeah, if you just want to pull your top to the side for me. And we'll just have a little look on here at this one. Okay. Yeah. Okay. And then again, we'll just have a little look at the size of that. And what we're doing here is we're just looking at the size of it. We're then also looking at the borders on there. Just have a little check of them, see if they're symmetrical. And we're looking at the colours as well to make sure if there's like a few different shades in there. Is it, yeah, has it changed colour at all? Anything? No. Okay. Yeah. To be quite honest with you, neither of those concern me at all. They look absolutely fine. But what we will do is send you to dermatology just to get them checked. They will take photographs of both the skin lesions, just under certain different lights where they can get a better look at it, and they'll do their own assessment from that point. If they do have any further concerns or they cannot confidently identify it as a certain type of lesion, they will then do a biopsy for you and yeah, confirm exactly what it is. But that is again if they have any concerns. They may be able to do the photographs, analyse it and be confident in what it is. And I myself, yeah, they're not screaming red flag to me at all. Yeah, so I wouldn't worry. Your chest is sounding very nice, very clear. There's no crackle or wheeze. Your heart sounding great. I know you say you don't have any symptoms there. No temperature. Your throat, your glands, all looking great. So I think I know with you saying that you might be just a little bit under the weather recently, I think it is probably just a bug. Yeah, I think you probably just have something viral. I would give it a couple of weeks. It can take a couple of weeks just to bounce back to normal. Okay? And if you do have any further concerns or anything doesn't improve in the next couple of weeks, please come to see me again and we will book you in some bloods. Yeah, and we'll just have a quick assessment. It could